Hey everybody, it's Kevin and it's Donna, and welcome to the Med List. Donna, I love to rock my cougar attire, but I've got you knew I had to do this after this weekend. But I mean, it is a huge go Cougs when we get to beat UW. They leave us for another conference. They're dead to us. They broke our hearts, and when they already have done so many years. But the Cougs win there, and then the Pack is back. We're rebuilding, so lots of excitement in the Walker household when it comes to the rebuilding excitement of a college football season. How about everything in the Bartlett home?
Everything's good, and we love our football here too. But yeah, we've just been busy enjoying the beautiful weather of September and moving people and occasionally catching a glimpse of some football here and there. So yeah, we've been moving and grooving.
I love it. Yeah, so that is definitely near and dear to my heart, but I think the subjects we're going to touch on next, Donna, are near and dear to both of our hearts, and I think they affect so many families and really is some issues throughout the healthcare world that our next guest is really an expert on multiple levels of it. So really excited for you guys to learn more about this space and some of the issues and some of the things that Eric has found successful. So we'll hit the reel and we'll go. All right, let me bring Eric up on stage.
Yeah. So welcome, Eric. Today we have with us Dr. Eric Speck, and I'm just going to share a little blurb about you, Eric, that you share on your website. Shortly after earning his doctorate degree and gaining entry into his dream profession, Eric found himself stripped of everything due to the choices he made. With his world spinning and feeling completely lost, he was unable to find guidance and answers he desperately needed. It was through his resilience and determination that he was able to find the answers from within and reconstruct his life from the ground up. Eric now has a successful professional career and a wonderful life. He's married to a woman who's beyond his dreams, with whom they have two beautiful, wild, young children. So I know your story resounds with many others in our world. In the US, I know people near and dear to me that have struggled with issues of substance use disorder, and people whose careers have fallen because of it. And it's great to know that people can pick themselves up, and it takes time. So Eric, thank you for sharing with us today and for being a part of the Med List, because as we know, and as we spoke before, the Med List is such an important part of this. So please, we'd love to hear a little bit about your story and get into some of the other highlights that we would love to talk about with you today.
Sure. Yeah. Thanks for the intro, Donna. And Kevin, thanks for having me on. I'm excited to be here. I feel like I used to talk to Kevin all the time, and it's been a bit. So I'm glad you reached back out to me and we got to reconnect. I
miss you.
will say I'm not a big sports person, and so like I don't know who the Cougs are. I don't know why you're wearing that funny sport coat, but it's cool. And the cuffs. Oh, okay. College stuff. But yeah, I always like your sport coats that you wear. I don't know if I can pull that off, but you do it well.
I don't know if I can pull that off.
I'm not pulling it off is what I'm trying to do here, but hey, it was $5 at Walmart and mom bought
No
it.
way.
So I rock it as often as I can, buddy. Just gotta have the spirit. So
I love it. I love it.
I gotta come down and get a visit with the Speck family.
Yep.
Fast forward just a little bit. So you married way up. I mean, so did I.
Yeah.
You married way up, have beautiful boys, just absolutely fantastic. Give us kind of the breakdown, Eric, of what some of the things are that you're doing, I guess, now, and recognizing when you look back. I think that perspective is one I haven't heard from you, present day, looking back on the things that you've been through to today.
Yeah. I mean, there's a lot there. I will say when I was going through that real difficult time, shortly after I became a pharmacist, life got really, really bad for me. And I thought I had life figured out. I think like a lot of people, you go to college, you think you're so smart, you know everything. You go to pharmacy school, you graduate, you have a doctorate degree, you think you're the smartest person in the world. Your parents are dumb, and you think you knew everything. And real quick, I learned how little I realized about life and about myself. But speaking about my wife, I met her, a few years after I got introduced to recovery. And when I met her, I knew instantly that she was the one for me. A big part of it is because she was the complete opposite of, the bad version of myself, like to the extreme. And I was like, I need that. Like, part of my story, what I want to talk about today is my drinking of alcohol that then led to other substances. When I first drank alcohol, it was like I was in heaven. I was like, this is great. I feel so good. Started talking to my wife. She doesn't drink alcohol because she doesn't like the way it makes her feel. And I'm like, that is so weird. And she's never tried smoking anything. She's never tried any drugs. And I remember she asked me, she goes, why do you want to do that? And I said, well, my whole life, I wanted to change the way that I feel. I never felt good. So I wanted to put something in my body to make me feel different. And she could not understand why somebody would want to change the way that they feel. And I just thought that was so cool. I was like, man, that is neat. If I can ever get to that place where I'm just like happy and content with like who I am and I'm feeling good as me, that would be awesome, because I never felt that way. At least not growing up. So yeah,
Wow.
being around her, I've learned so much about life. And all those things that I thought I knew, many of those things were wrong. And I learned a lot of things I didn't even know existed. So definitely glad that I met her, and yeah, we have two beautiful children now, and we're raising her, um, you know, the right way. All the lessons I've learned from my mistakes, and all the strong points and the benefits and the highlights from my wife. Really raising these two little boys to be amazing human beings, and that means everything to me. That's my number one priority, is raising these little guys.
So
Super special.
So Eric, I've never heard your complete story. I know you work a lot with people and you're a mentor for people, but could you share a little bit more? You started off like with alcohol, and then
Yeah.
I'm assuming, was it prescription meds or other meds or a little bit of everything? If you don't mind sharing.
Yeah. Yeah, a little bit of everything. So yeah, let me kind of start at the beginning, and then this leads into really what I want to talk about is, how healthcare providers, doctors, prescribers are so readily to prescribe medications. And I think it's especially unique in the U.S. We take more medications. You know, I'm not an expert on these statistics, but I believe, as a country, we take more meds than any, other similar country, and we are one of the most unhealthiest countries. Also, you think if we were taking all these meds and they were good for us, we'd be the healthiest country, but it's like it's not. It's the complete opposite. But yeah, like I said, from a young age, I wanted to change the way I felt, and I won't really go into why I think that was the case, but it's pretty common. I had this kind of emptiness inside of me, something I didn't like, and I started experimenting with alcohol when I was 14. Is when I had my first drink, and I really liked the way it made me feel. The second time I ever drank, I got blackout, drank until I couldn't drink anymore. Got blackout drunk, actually got in trouble at a freshman high school party. The police were called. And that was my first encounter with law enforcement due to substance use. And I was 14 drinking. Um, and I continued to drink. And I learned my lesson for a little bit, but it didn't stop me. I continued to drink. I continued to experiment with some other things. Never got carried away with it. Never got, addicted, but I definitely experimented and continued to drink throughout high school and throughout college. Um, and when I was an undergrad, my drinking escalated. I was drinking more and more, and I was still unhappy. I was depressed. And it's hard. It's hard to describe also, because life was going great. I was doing well in school. I was kicking butt. I was getting ready to go to pharmacy school. I was going to start applying. My grades were great. Life was good on the outside, but there was something small inside of me that I didn't like, and I tried to numb those feelings. And when I was an undergrad, I ended up getting a DUI where I crashed my truck and totaled my truck. Interestingly, it was due to celebrating my acceptance to pharmacy school. I won't go into the whole story, but we went out partying. Eric got into pharmacy school. Congratulations, like the best day of my life. Let's go out and let's go out and get smashed, right? It seems like the logical thing to do. It really doesn't, but at my time it did. It's like, that's normal. That's what you do. You celebrate, you go out and you get trashed. And that was normal, or that was cool, or whatever. That was kind of my thinking. So we were celebrating, and the night, went longer than we had originally planned. Then I ended up wrecking my truck. And that was really scary. I want to say it was a wake-up call. It wasn't so much a wake-up call. It was really scary. And, kind of saying like, wow, you need to be really careful of your actions. These bad things can happen. It wasn't going to stop me from drinking, but stop me from drinking and driving, at least for a while.
Yeah.
Be more careful about it, whatever you want to say. But because of that incident, I knew something was wrong. I knew something had to change. I told myself that I was drinking so much because I didn't like the way I felt and because I was depressed. And this is what I really wanted to get into. So I went and saw a physician at the university I was going to. And I said, hey, here's the deal. I'm drinking too much. I think I have depression, and I want to get started on an antidepressant. And she was like, sure, I'd be happy to start you on antidepressant. Like, did you have anything in mind? Like anything that you've heard of you want to try first? And I did have my dad mentioned something to me. My dad's a pharmacist, and he's seen what works well for his patients. And at one point he had mentioned an SSRI to me. And so I mentioned that to her. I said, yeah, I'd like to get started on this SSRI. And she goes, cool, no problem. And so she started me on antidepressants, which I was on for about 10 years. But taking a pause there, I think about it as I get older and I get wiser. So readily threw those SSRIs at me. Just like, sure, here you go. My first visit with her, she didn't try anything else, therapy, this, that. It was just like, here you go. Alcohol is a depressant is what comes to mind now. It's like, you dummy, you're not drinking because you're depressed. Well, maybe, but you're definitely depressed because you're drinking so much. I mean, you're drinking so much, you're getting DUIs, you're wrecking your truck. And we all know alcohol is a depressant. Leads to depression, depressive symptoms. You get that euphoria at first, but after that, in long term, you get depressed. But she didn't even say like, okay, how about you stop drinking first, give that a month, try these other modalities, then come back to me, see how you feel. It was just threw the medications at me. And I will also say, being I'm actually a third generation pharmacist, and my family owned 3 independent pharmacies. And I grew up ever since elementary school working in my family's pharmacies. And think about that for a moment. What perspective a child has about medications and the world when, you're day in and day out as a young child seeing everybody getting medications. I mean, my dad, he's running back and forth to the counters, answering phone, counting pills, doing this. To a little kid, the whole world takes medications, and they take a lot of them. Because that's what it looked like for me. That's all I knew. I think everybody's taking medications because they're throwing pills left and right. At least that's what it looks like to like a little kid.
So true.
Yeah.
And so I think as I got older, it was so normal to take meds, and everybody take meds. There's not necessarily anything wrong with taking meds. So like, please, don't get me wrong there at all. They definitely have their place, 100%. But to be so readily to prescribe them, and for me to get them, I often think about that. Like, yeah. And so anyways, I continued on SSRIs for, like I said, it was like a total of 10 years. During that time, I continued to drink. So, I was still depressed, or I just had a substance use disorder. And later that escalated when I graduated with my pharmacy degree. Kevin knows this. I'm sure a lot of people watching this who've heard my story before, they know this. I started diverting medications from the pharmacy I was working at. I was working at a small independent pharmacy, not my family's. I wanted to kind of move out of that region and settle down somewhere else. But I found myself diverting narcotics to get the same result as what I drank alcohol for. And honestly, I knew alcohol was getting to be a problem. I had more and more bad experiences, embarrassments, regrets from drinking. So I knew drinking wasn't good for me.
Yeah.
But these pills, these things must be good. I remember my dad was given 240 Norco 10s out with 90 Somas and 90 Valium all the time. It was like, there must have been a lot of pain and muscle problems where he worked, but it made me more. I'm trying to think of the term somebody described it. More kind of numb, I guess, to the effects
Mm.
of those. So I think I could take these. Like I've had pain medication before. I broke my collarbone multiple times. They give you 20 Vicodin or something. Like, yeah, I like those. You get your wisdom teeth pulled out, you get some Vicodin or something. You're like, yeah, I like those. I remember that feeling. And now here I am. Well, they must be safe. I remember these people taking hundreds a month, and they were fine. They seemed fine. We give them to all these patients all the time, so I thought it would be safe, relatively safe to take them. I thought I would never develop a problem with these medications. I can conquer anything. Don't you know who I am? I'm not an addict.
Yeah.
And man, eventually those, the opiate specifically got a hold of me. Like I couldn't believe. I couldn't stop. I couldn't function. I couldn't live. I couldn't get out of bed. I couldn't make it to work unless I took a handful of pills. And again, it kind of goes back to so easily starting SSRIs. They're harmless. In my mind, taking these, painkillers and other narcotics, they're relatively safe. It's not going to be a problem just from my past and, kind of being, not realizing the effects, because you see them all the time. It's like regular. Everybody takes these kind of thing.
Right.
And then,
One thing is you said that like the normalizing piece, several times. I hope our audience catches that because you do it very purposefully, like when you're doing your speaking components, to let everybody know it didn't seem abnormal to do it. Like it seemed like a very normal, logical decision along the way. And I feel like that's the case for so many people. Like when it comes to the first decision of going in, wanting the SSRI to help with some depression, right? It seems like it feels like the logical decision. Like there's all these commercials about antidepressants. You've got a bunch of people that you potentially know that are taking antidepressants. Same thing with alcohol. A lot of folks grow up and their families are all drinking alcohol, very normalized, thing to be able to do.
Yeah.
How do you feel like, Eric, in that space, now that you have this perspective of like what was normal, when you look back on it, what wasn't normal about it? Like what do you realize shouldn't be normal about that process?
Man, and I think, in pharmacy school, we talk about, first line therapies, and rarely is, medication, first line therapy. You have lifestyle modifications and stuff like that. So I think we need to do a lot more of those kind of modalities. I wish those kind of modalities were, prescribed to me prior to going on medications. I also mentioned like, my dad, who I was closest to growing up, worked with him in the pharmacy, or I shouldn't say worked with him. I was there while he was working. I was watching. He never took any medications. He was very, very much against medication. I just don't take them. And same thing with alcohol. He never drank growing up. He was very much like against alcohol. He just didn't touch it. So it wasn't any of that. My idol, because he does it, I want to do it. He was very much the opposite. But that didn't affect me, obviously. I'm just like, okay, well, he doesn't do it, but everybody else does. I'm everybody else too. I'm not him. I'm everybody else, just like all these other people.
Yeah.
And another thing that I talked about raising my kids to be the best humans they can be and equip them for life the best that I can. Is I didn't have any healthy coping strategies or healthy modalities to deal with my feelings. I never learned any of that stuff growing up, like not even to talk about your feelings. My dad raised my brother and I as a single parent, and he was busy working, and he was very much I don't know, I want to say kind of like manly man, I ain't gonna raise no sissy kind of thing, which I think is pretty typical. My dad didn't do anything wrong. I love my dad. He did a great job. He did the best job he could be. But one thing I never got growing up was those tools to help myself when I'm not feeling well. And so I turned to substances. That's what I knew worked. So they worked really well until they didn't.
Yeah. Eric, I think we see that too. Like this can happen to really anybody. It doesn't mean, however you were brought up or, whatever your circumstances are, unfortunately, or there's no one person who we can look at and say, oh, they're going to have an issue.
Oh, absolutely. Yeah. I mean,
So
yeah, I always say, like, they say addiction doesn't discriminate.
no,
You could be, any ethnicity, any color, any, socioeconomic level, poor people living on the street, the richest person. I mean, the whole spectrum. It does not discriminate. And the other thing I talk about in my talks too is the consequences don't discriminate. Some people think they're too good, they won't get in trouble. It's just like, no, I mean, no, it doesn't matter. Consequences don't discriminate. But sorry to interrupt, Donna. Go ahead.
No, it's fine. So I want to get into so here you go see this doc, and I think I need this, and we see this all the time with the commercials that are online, right? Oh, I need this, or oh, this isn't affecting me well enough. I think I need to add this on, and you can see that occurring. So I want to get into that whole idea. And you also talked about, why was that a first line for me when I
Yeah.
could have been spoken to a little bit more about alcohol use and, what's going on, and maybe getting some counseling early
Yeah.
on, or various, listening to some other people who are really thoughtful about lifestyle and
Hmm.
trying to bring exercise into your life, so that helps with anxiety, makes you feel better, helps with depression.
Yeah.
So instead you go in, you say, hey, I think I need this, and they go, okay, here you go. So we know we are in an overprescribed world. So I would love to hear a little bit more about, that perspective, because now I'm thinking, you go and you've started on all of this, you're taking more
Hmm.
meds, and
Hmm.
now you're like, okay, you're getting help, you're making changes, and you're saying, I don't want all this.
Yeah.
And then you get resistance. So I would love to hear the patient perspective of you trying to be like, whoa, what is going on here? I'm assuming you got to that.
Yeah. Yeah. Yeah.
The barrier is that the prescribers are resistant. Like, sometimes we see it the other way, right? But you
Sure.
as a patient going, I don't want this anymore. So before
Yep.
you first go and say, I want this, and you
Yep.
get it, and now you say, I don't want this anymore. And then they go,
Yeah.
no.
Yeah.
Can you
Yeah. Well, yeah. Yeah. Let me get there. Let me talk a little bit more. So I was talking about my opiate addiction, how I got into that.
Mhm.
And that was the worst time of my life. I mean, life got 1,000 times worse than I ever imagined it could possibly get. One of the treatment centers I went to started me on Suboxone, right, which is a blessing and a curse. I won't get too much in the Suboxone thing, but it's not this big miracle drug. It seems like everybody thinks it's a big miracle drug now. I'm like, that just, excuse my language, guys, but that shit sucks, right? It doesn't suck as much as like dying from an opioid overdose or, coming off withdrawal, but it sucks. I mean, I'd never want to be on that again. But man, taking the Suboxone, it really helps with my withdrawal symptoms, right? And that's what was killing me. That's what was keeping me up. That's what kept me going back to more and more pills. But I had side effects from it. One of them was I couldn't get up in the mornings. And so I shared this to my doctor who was prescribing Suboxone. I was just tired. It just kind of like, I don't know what it was. I had a lot of hard time getting out of bed in the morning, and I had to work. I was actually working as a pharmacist at this time while on Suboxone, and performing well as far as I can tell. And I never had any incidents or anything. But he immediately prescribed me Provigil, right, to make me more alert in the morning. And at this point, I've kind of given up. I'm in recovery. Like, I'm just surrender to my higher power, surrender to my doctor, surrender to the pharmaceutical company, or whoever, as long as it's not me. And I may have went a little bit overboard there or something. But man, he started prescribing me Provigil in the morning, giving me free samples because my insurance wouldn't cover it, because they were like, yeah, we don't cover it for that indication. And it was like, no indication. It was just like to treat your Suboxone use or something. So I'm getting like all these free samples. The insurance won't cover it. That should be like a red flag, right? Like, maybe we shouldn't be giving this to you. But he didn't care. I didn't care.
Wow.
And then tapering the Suboxone, I had a lot of the withdrawal symptoms. And then he prescribed me like Ambien and Restoril and this whole other handfuls of medications to help me sleep and help with my symptoms. Man, and out of all the things that I did and all the narcotics that I took, and 500 milligram equivalents of morphine equivalent dose or whatever they call it, like 50 Norcotins a day was kind of my standard for a while. 15 right when I woke up.
Wow.
Like, you know, um, there were never really incidents because of that. But all these other medications the doctor was prescribing me, especially the Ambien, that's what messed me up. You hear about these crazy Ambien stories. People take Ambien and do crazy things while sleepwalking. That's me. I mean, I had 3 law enforcement encounters due to taking Ambien, just doing stupid stuff. One time it led into me causing $100,000 worth of damage. I won't go into the details because I was on sleeping medication. Yeah. And, you know, criminal convictions and all that kind of stuff. And it's like, man, all I'm trying to do is taper my Suboxone and get a good night's sleep. And then all these crazy things happen. But I think when you're putting that many meds and chemicals into your body, there's so much weird stuff going on. And yeah, I'm still keeping your question in mind. So I eventually got off the Suboxone, got off the Ambien and everything. Life was really good. I was still on my SSRIs. And it wasn't until about, man, I know I said I was on them for 10 years. It was really, yeah, I guess it was about 10 years, maybe 12 years I was on them. It wasn't until a few years ago I wanted to get off of them. I just feel like I don't need them. I feel like they're not serving me anymore. And I had a new provider at this time. And I remember approaching my provider saying, I want to get off of them. She goes, how long have you been on them? I'm like 10 years. And she goes, oh, well, people who've been on them that long are going to be on them for the rest of their life. And she was not even like willing to listen to me about getting off of it. It was really upsetting. Yeah, you're not going to be able to get off them. Like, where's the encouragement? Where's the empowerment for me as a patient? Yes, you're going to be able to do this. You're going to be able to work together. It was just like, nope, you've been on, you're going to be on forever. Like, I've seen it so many times. You're not getting off those things. I was like, what? It's terrible. I mean, you know, maybe better providers would have gone about it differently, but this provider, it was really surprising. Yeah, I ended up self-tapering, getting off of them, you know, by myself.
Wow.
And it was tough. It was tough. And that's the other thing, you know, people start somebody on SSRIs, they're like, it's a safe drug. It's not addictive. It's not a controlled substance. But man, those things are hard to get off of. I don't know if it's because I was on them for over 10 years, but I mean, it was a struggle. I mean, ask my wife, she was around for this and she's like, you were a jerk, you know, like a huge jerk. You were not a happy person. I wasn't. I wasn't. It took a while before I started to normalize and everything started to recalibrate.
You know, Eric, if you wouldn't mind, I want to double click on something he just said there, Donna, for the audience to be able to kind of understand. Most of the time when we talk about getting off of drugs, when we hear the word withdrawal, general society thinks opiates. Like those are the only things that cause withdrawal. So that folks know, I'm just going to list off a few things. Prednisone, brutal withdrawal symptoms.
Yeah.
All antidepressants typically all have some kind of withdrawal symptoms, or some that can naturally taper, but we won't get into that. Everything with benzodiazepines, brutal withdrawal symptoms that go along with them. So all these medications are not opiates. They're not pain drug related. They're very commonly used for all kinds of issues that society is experiencing. And Eric then mentioned something else called Suboxone. So Suboxone is being used to help us get off of another drug, which it causes other side effects and problems that are not advantageous for the individual to wake up and go, I'm going to take my Suboxone and have a great day. There's things that they're struggling with when it comes to now you have the pressure of saying, I could stay on this drug for the rest of my life, which Eric just said, the physician said that's what you could do. The other part of you says, if I get off of this drug, it's going to be difficult or painful, or I'm going to have to go through something to get off these medications. And yet still in society, Eric, we have the willingness to just put somebody on a medication instantly when they first ask. I feel like that's something I'd love to hear you talk about a little bit more with those things on just, I know you wanted to highlight how difficult these drugs are to get off. Any other anecdotes you want to make sure the audience hears?
Man, well, I'll tell you, when I got off my Suboxone, you know, I was being treated at an outpatient clinic and they prescribed Suboxone regularly. I was on Suboxone for about a year. I didn't like the way it made me feel. You know, it made me not be able to enjoy life. Didn't have withdrawal symptoms at all until I started tapering, you know, which was intentional. Then I experienced it, but I wanted to get off of it. And I successfully did. And it was brutal. It was brutal. But I remember asking my doctor's office, I told them I've been off it. It was like for a few weeks. And they were amazed. And I'm like, how many people have you guys gotten off Suboxone? They looked at each other and they said, you're the first one.
Wow.
Wild. Man, but yeah, I remember.
So Eric,
you know,
can I just ask you a quick question about that?
Yeah.
Did they work with you to do that? Or was it kind of like, do it like this and see how you do? But like you probably won't be successful. But did they encourage a little bit and say, you know, here you go, give it a try?
Yeah, they did. They did. And it's kind of that balance between like, let's do what the patient wants to do versus let's like intervene. My case, I wanted to get off Suboxone. It was like a non-negotiable for me. So we had a taper schedule. And then when I started experiencing symptoms, Suboxone comes in strips. I had 8 milligram strips and they were so hard to taper. So you'd cut them in half at first and you'd cut them in quarters. And pretty soon you're cutting them into like eighths, just like little slivers. And for a while, all I needed was a little sliver at night to kind of like help me sleep and prevent those withdrawal symptoms. So they were okay with me tapering down, but then again, they were prescribing me all those other medications, especially like the Ambien and the sleep medications and the benzodiazepine to help with my withdrawal symptoms. So I mean, they're in a tough spot too. They're like, this guy wants to get off of them. We know how painful it is. Let's throw these other things at him to help him. It's like,
Yeah.
they're in a tough spot. They don't know any better. So yeah, they worked with me to do it. I remember periodically they kept recommending I increase. Okay, we need to bring you back up. You're experiencing too much withdrawal symptoms. You're tapering too fast. Come back up. And I never wanted to. I was like, I'm not going reverse. I'm not going reverse, guys. I'm on a mission. I'm on a mission. The last one other thing I'll say about the Ambien, when I was completely off of it, I was working as a pharmacist during this time, and completely off for 3 months, even after that long taper, for 3 months after being completely off of it, I would sweat so much. And I don't know if it was my body trying to get the toxins out. I don't know if it was a withdrawal symptoms or a combination of the two, but I used to bring 3 changes of undershirts. And I used to go out to my car working to change my undershirt because I would sweat through it.
Wow.
That occurred to 3 months after being completely off of it. I mean, it's just wild to think how powerful that stuff is. I remember when I first started using opiates, and I remember the first time I went to treatment, I Googled it, like, how long does opiate withdrawal last? It's like 5 days or 7 days or something. Like, that's not too bad. I can do anything for 5 days or 7 days. Like, it's not, man. It's like 30 days minimum. It's intense. And then with Suboxone, I think it's longer and longer. You have these lingering withdrawal symptoms. And I think everybody's different too. I think I'm very susceptible to addiction, and my withdrawal symptoms for me are like, I don't know, a lot worse for whatever reason. But man, that's how it was for me. And it was unbelievable. I'm like, how am I still having effects from something I took, nearly 3 months ago?
Yeah.
Like, it's so severe too. It's not just like a little thing. It's like, it's clearly, soaking through my shirt. It was wild, man. It was wild stuff, man. It was wild stuff. I ain't never going back. I'll tell you guys that.
Yeah.
You touched on one thing, Eric, that is basically this. If you can avoid getting on these medications, do, right? I mean, if there's a way for you to avoid getting on some of these medications, then do. So I think that's
100%, man. All of them. And the more that I learned just about, I don't know, how everything works, pharmaceutical industry, even the food industry now. Yeah, I mean, they should be like a last resort. And there are so many things you can do to not get on medications, for the average healthy person. Some people have medical conditions, if you're a type 1 diabetic, if you have a heart condition, not due to lifestyle factors, the list goes on and on. Like, yes, definitely you need to take medications, but for, somebody like myself, I'm healthy, I don't have any medical conditions. Man, I just need to take good care of myself physically, emotionally, spiritually, and all that good stuff. And, hopefully never be on them again. If I'm having a bad time and it's like, yeah, there is a drug for that, well, I'm going to do everything I can do first before I go that route. And for people listening to this too, like, this is me, I'm talking about from my perspective. And as you've seen, like, I've had a very bad experience with prescription medications. So like, please, like, I'm not giving like medical advice or telling, what you should do. I'm just saying what I should do strictly. If you want to follow that, you think that's for you, that's great.
That leads me into exactly what I wanted to hear, Donna, and I hope it kind of connects to your question you had. But Eric, I love that we don't want patients to get on medications if possible. But that's the case for so many, right? So many of folks have already started on various medications, and your perspective on how to get off these medications, the issues that you encounter, and some of the things you learned along the way is so unique. Any things you'd like to be able to share for those folks that they've already started an antidepressant, they've already started a benzodiazepine for anxiety or sleep or whatever the case is, they're on opiates because they have a chronic pain issue, but they want to get off. What are some of the things that you'd like to be able to connect the audience on? here's some hurdles you're going to have to get over. Here's some things that you're able to find out through your journey to give them a little bit of hope or guidance in one way or shape or form.
Man, like with the medication thing, always go slow. Always go slow. It's like you've been on antidepressants for 10 years. It take a year to get off of them. Don't try to do it in a week or like a month. Work with your provider, of course. If you have a good provider, work with your provider. And the other thing is, it all depends on the condition that you're being treated for as well. But I'll use my personal experience with my antidepressant, my depressive systems. Growing up, I was very much a individual kind of person, kind of a lone wolf. I didn't play team sports. I did competitive wakeboarding, snowboarding. I was on a rifle team. I was on an archery team. All these individual sports, like it's just me. It's just me. At the same time, I didn't have a close group of friends. And I think I was lonely a lot.
Yeah.
And that is something that leads to depression. So like in my case, before I start trying to taper my SSRIs, my antidepressant, well, we know that humans are social creatures. We're generally happier when we have healthy relationships, close relationships, intimate relationships. We'll go find a support network and develop those healthy, close, intimate relationships. So therefore you get the love, the compassion, the comfort, the support from those people. So when you come off of the antidepressant, you have people who are providing you antidepressive type effects as well.
Wow.
So yeah, that's a big takeaway for antidepressant. That was a big key for me, is a support group. Kevin knows I talked about my support group for a while, and I'm still not perfect, and I'm busy. I work like crazy. I got a side business. I'm a husband and a father, so I don't have time to be hanging out with a bunch of friends and everything. But I know how important it is, and I always make it a part of my week to connect with individuals who are close to me, keep those relationships strong.
Yeah.
But yeah, and there's so many things you can do. If you're talking about like physical health type stuff, I mean, and especially now, I think what I'm seeing, there's more and more research, there's more and more knowledge coming out about, if you have this medical condition, you could take these supplements, eat these foods, do these exercises, do this lifestyle thing. Just research it. And the drugs are always the pharmaceuticals are always going to be pushed on you. There's just so much money there. And I think there's so many people involved in that supply chain who are being manipulated by money, where you're always going to be getting the pharmaceuticals and stuff pushed on you, versus you have somebody else who's saying like a lifestyle modification. Well, there's no money in that. So, not that many people are going to be saying it. You have to look a little bit harder. But the good thing is I feel like I've been seeing more and more, especially in the past year or so, there's a lot of people coming out with some really good information about what it takes to be healthy, and kind of revealing the pharmaceutical industry and the food industry. I don't want to get into all that kind of stuff, but like if you look into that stuff, I love it. And I love people are starting to speak up against this stuff. So yeah, solutions are out there for a lot of things, and a lot of them aren't, pharmaceuticals. It's not, getting a prescription drug. And as we were talking about earlier, you look at other countries, like other countries are healthy. They're doing better than us in so many regards, and they're not taking nearly as many medications as we are as a country. Well, maybe you go find out what the hell they're doing and do that, whether it's food, walking more, exercise, maybe it's more friendships. I have a friend who just got back from Greece. He lives over there in the summers, and he goes, they take naps during the day. I'm like, that sounds good. Maybe we should all start taking naps. We'd have more energy. We'd be happier, lower blood pressure, longer lives,
Yeah.
Yeah.
So I think you bring up a good point too. There are times when folks do need medicines, and none of us dispute that here.
Mm-hmm.
And even for a depression too, that they can't get out of. Like, it is important that people take medicines. I think one message that I really like, and that we're seeing, I think, a little bit more very slow progression with, is when you get a prescription, it really should come with how long you probably need to be on this for, and and when you might be able to start coming off of it.
Yeah.
Um,
Yeah.
let's talk about this. So antidepressants, we know like 6 to 9 months typically you
Hmm.
need to be on it in order to get through an episode.
Yeah.
And then after that, you should start having these conversations
Right.
about, can we start to get off of this versus
Yeah.
you showing up 10 years later and saying, I want off of this,
Yeah.
and just having it continue on and on and on for 10 years. So I think that that is a real important practice for even the providers to be thinking about is, I'm writing this, when's the longest that I want them to be on this for, so that they get the help that they need, and then when can we start tapering this off, or
Yeah.
or stopping it. We do that with medicines for bone building, right? With the bisphosphonates. We do
Yeah.
it with prednisones, and
Yeah.
antibiotics, etc. um,
Yeah.
so we even need to, and even when people are trying to make lifestyle changes, we do it through like, oh, your blood pressure has come down. You had medicine to help, but now you've made these lifestyle changes and you've lost
Hmm.
weight and you're exercising more. And we don't want your blood pressure to go too low. So we're going to start tapering off.
Yeah.
So there's no difference between those types of medical issues and depression that we should, or anxiety, that we should be saying, all right, yes, you do need this now. We got to get you through this
Yeah.
XYZ
Oh
time
yeah.
frame. And then let's start talking about it. So empowering both prescribers and patients to think about that when these prescriptions are started, I think is a really important message.
Yeah, 100%. It's like, okay, cool. We start you on, SSRI. We're going to follow up with you in 2 weeks. Everything is good. We'll do another 2 weeks to push it out for a month. Then your 9 month mark or your year mark, like put in your
Yeah.
Google Calendar,
Right.
put that
Absolutely.
thing in there, man. So it pops up. Like, um,
Yeah.
yeah, one of the things I remember learning about was the benzodiazepines in pharmacy school. I think the maximum recommended duration is like 2 weeks. And like I said, working in the pharmacy, I mean, we got people getting Xanax and Valium like month after month after month after month. And I'm like, well, if these are only recommended for 2 weeks at a time, like, why doesn't somebody stop it? Like, why doesn't the insurance company say like, oh, nope, only recommended for 2 weeks, can't pay for it? I don't know, maybe they had a prior auth or something else is going on, but I don't think so.
Yeah.
Um, or why doesn't like the DA like send a letter to the doctor? Hey, you can only do this for 2 weeks. I mean, it's. I think things have changed more recently as well. Like hydrocodone's a class 2 now. It was a class 3 when I was doing all my stuff, and I think they're cracking down on some of these prescribers and everything. I think it's gotten better,
Yeah.
but
It has,
yeah,
Eric, but I have to say, I've also seen a shift too in practice where instead of this whole opioid epidemic that we've been through, now they're trying to reduce the amount of opioids and they're adding on gabapentin, for example. So
yeah,
another product that it's used off label typically for pain, but
yeah,
we know that once you get to higher doses, anything over 900 milligrams with an opioid is actually going to have detrimental effects, especially with um, um, respiratory depression, not being able
yep,
to breathe as well, and
yep,
also increases the risk of addiction. So we're getting these signs, if you will, or information that, don't think that you're putting a band-aid on, or taking care of this opioid addiction by adding on gabapentin. We know that gabapentin is also sought after, and it also adds to addiction issues as well. So I think things appear to be better, but there's something
yeah,
else taking its place. And I think that is something we always have to be careful of, is what else is taking the place of what is getting better.
No,
very
so
true. Yeah,
you
you
know,
mentioned. Sorry, you mentioned gabapentin. I was prescribed 3,600 milligrams a day of gabapentin for a few years. That started during around my Suboxone period. Yeah, 3,600 milligram, like the 800 milligram ones. There's like horse tablets. It's like 4 horse tablets a day. Yeah,
oh my God. Yeah,
yeah, yeah. So
multi-
I know how they are. Yeah, I mean yeah, gabapentin is something too. I mean it's tough though. I mean gabapentin and hydrocodone, oxycodone is two completely different categories, and I'll argue that
Mhm.
for forever. But I hear what you're saying. And I remember reading a report recently where they're looking at the ODs from opiate withdrawals, and they said, I forgot what percentage it was that had gabapentin, but it was an extremely high percentage. So there is something going on there. Yeah.
Absolutely.
Yeah, I think that multimodality and the opiate sparing is definitely something that we need to have another conversation on here sometime soon. The one thing I want to bring up with my last question here, Eric, it's crazy how quickly this time has went, buddy. Thanks for all the
I
info.
know.
Is you mentioned something several times, bud, in the beginning, and you said it to me several times previously. You said it was something about the way I felt. I knew that I wasn't feeling well, and I wanted to change the way I was feeling, right? With one drug or another. It wasn't necessarily the I need this drug. It was I need to feel differently than I do now, right? And so my question is kind of along those lines, Eric, for you. That the world that I live in oftentimes is in like the monitoring space. Like, how do we monitor the way that we're feeling, overall?
Yeah.
And there's various studies out there when it comes to pain, for example. Like, we're able to do voice recordings or do facial analysis and see these changes in blood pressure, facial analysis, activity level, et cetera, are showing rises and falls in pain level, right? So that we can move from subjective, meaning this is how I feel or think, to an objective analysis of pain, right? Overall. What are some of the things, Eric, you've learned and seen over time when it comes to kind of doing a check-in on the way you feel so you can see how well a therapy is working or how well anything you're doing in life is working and if it's worth continuing? Can you pontificate on that for a second, bud?
Yeah, for sure. I'm going to pivot from that just a little bit. One of the biggest things that helps me now, which I did not learn, was not taught when I was younger, and this was a big problem for me using substances, was the simple fact, or whatever you want to call it, that it's okay to not feel okay. So like today, if I'm feeling down, not having a good day, that's fine. I don't need to do anything about it. It's temporary. It's going to go away. Just like when I'm happy, that's temporary too, and that's going to go away. But man, I tell you, when I was younger, man, if I wasn't feeling good, it was like an alarm in my brain. Renew, problem, problem, problem. Holy shit, like something's wrong. Go fix it. Go fix it. Go fix it. Then, grabbing drinks, doing other stuff. Oh, I feel better now. Okay, cool. And then every time that happened, it was when I first entered recovery. My very first sponsor told me that, and it was mind blowing. Hey, it's okay to not feel okay. I was literally like, dude, I did not know that. I'm 25 years old. Nobody's told me that. So that's a big part of it. Like, that helps me today. It's like, it's okay to not feel okay. Man, I think the other part of it too is like, how am I doing, emotionally and otherwise? It's, well, I'm going to decrease the number of those moments I have where I'm not feeling okay. So that's kind of my indicator. And then it's all about healthy things, man. And my life has changed so much from where it was to where it is today. It's hard for me to think of all the changes I made, but I tell you, I don't stress as much about the little things, and I don't care about what people think. I don't know if my job's going to see this, but I don't care that much about my work. Like, I don't get stressed over about it. Like, it's just a job. It's okay. If I lose my job, I get more money. Whereas before, it was like the end of the world. I was like, well, what is important? It's like, well, I need to, I took Wednesday off, half day off, to like go to a play thing with my kids. And I never used to do that because I was like, work's not important. My kids are important. They bring me happiness. They bring me joy. I'm spending quality time with my wife. Whereas in the past, I used to be so stressed out and so focused on, I don't know, myself and other things, that I wouldn't give time and attention to the important things, which were like my friends, my free time, my hobbies, and everything like that. So I've kind of flipped that on itself. And I mean, don't get me wrong, I still get super sucked into my work, and I'm still an overachiever and say yes to way too much stuff. But at least now there's eventually a time where I'm just like, boop, I could put up this fence if I want to, and you're over here, and I'm going to go out there and enjoy my life, and life is great.
Yeah.
I've known it since the first time I met you, buddy. The way that you speak and enlighten people with just being so real, like, it's a beautiful thing. And folks, if you want to book an incredible speaker, this guy right here is a guy that I'd have speak at any medical university, any nursing space, any pharmacy school. I really think that, Eric, you have so many things to say, and you say it in a way that's so relatable to so many people, that I really appreciate that. Like, you're an extremely bright guy, and you come with an enthusiastic humility that I don't think a lot of people possess. So huge applause. I always appreciate you, bud.
Well said.
Yeah, I really appreciate that.
Yeah. Eric, thanks so much. I think that there's just one last point I would love to make, especially on the provider side and also on the patient side, is just thinking about this whole shared decision making. And I
Yeah,
think we touched on it throughout, but it's such an important part of the care cycle. And let your voice be heard if you're a patient, and providers, listen to the patients, and let's get these shared decisions going so that
yeah,
people don't feel stuck with taking too many meds, and
yep,
really thinking about that. Is this med still necessary? And how can
yeah.
we work with this patient to make them feel better without it?
Yeah, yeah, 100%. And for the patient's perspective, patients need to advocate for themselves more.
Mhm.
Um, I feel like a lot of times they feel like they don't have a word in their whole treatment plan, and like that's going to be further from the truth. It's like,
Yeah,
they should have full control over their treatment plan.
Wow.
With an asterisk there, of course, saying something, but yeah, definitely advocate for what you want. If you don't want to go on meds, if you want to get off meds, say that, fight for it, push for it. If you need to find a new provider, great, fire your provider. We've done that before. Um, Advocate for
yeah,
yourself because ain't nobody else gonna do it
yeah.
Oh,
unless you hire a patient advocate, of course. But you could do it pretty good for yourself. Definitely do it.
man, Eric, I tell you what, buddy, it absolutely flew by. Thank you for the insights. I'll always enjoy speaking with you, and we're at time. So if you guys want to check us out on the Med List, please check us out on YouTube, LinkedIn, Facebook. Where else are we, Donna? Amazon, Spotify, all those places. And if you do enjoy this episode, please share it with a friend or family member. I know that a lot of other people can benefit from hearing the wise words of my dear friend Eric Speck. All right, everybody, you have a wonderful rest of the evening, and good to see you.